Assume here we already have your bile salts that are bound to this fat droplet. So you have several bile salts already bound. Now your lipase needs to come in and bind to the fat. So here they're illustrating to you lipase and how it's interacting with one triglyceride. And so lipase is going to take that triglyceride. So when we break down a triglyceride using lipase, we're going to be getting monoglycerides and fatty acids. Okay, so they're no longer coupled together, right? So now what happens? So here we see how you have your fatty acid, and that fatty acid, remember, those are lipophilic. So fatty acids can freely diffuse across the epithelial cell. Once they get inside of the cell, their ultimate goal is to diffuse all the way over into the blood, right? You want to absorb these into the blood. We're going to come back to that. Now, not all of your fatty acids are going to be absorbed right away. Some of the fatty acids that do not freely diffuse right away, they're not absorbed. What's going to happen with them is they're going to aggregate with bile salts and cholesterol and some other lipid-soluble substances. And when they all aggregate, what we're going to call this aggregation is a micelle. As your fatty acids get absorbed, and the body needs to start absorbing more fatty acids, the micelle can actually release more products to be absorbed. So the micelle may release this fatty acid and then it may get absorbed. Okay, but that's as the body needs it. Let's go ahead and return to the situation where we freely diffuse our fatty acids, or our lipid, right? Our lipid into the epithelial cell. Remember, the goal is to get this lipid across and into the blood. And let's look at how this happens. Here comes your monoglyceride and your free fatty acid, right? And we know how they got across the apical membrane by freely diffusing. Now what happens to them? So they're going to enter into this organelle here called the smooth ER, which you're familiar with. Okay, remember that the smooth ER does a lot with fat, right? It synthesizes triglycerides. That's its function. In step 2, the smooth ER is going to reassemble the triglyceride. We broke it down before, now we're going to reassemble it. So that reassembled triglyceride then, I'm going to label this in number 3, enters the Golgi apparatus. The Golgi apparatus then, we know, modifies and packages and sends it out. When it gets exported, it's exported as a chylomicron. So this chylomicron contains the triglyceride, the modified triglyceride. So it's in a vesicle, right? That's what this chylomicron looks like. It looks like a secretory vesicle. So the way for any secretory vesicle to get out of a cell is via exocytosis. So number 4 here is exocytosis. So this cell has to exocytose the chylomicron that contains your modified triglyceride. This chylomicron is too large to go directly into the blood. So the chylomicron is going to bypass the blood completely, and it's going to enter a structure called the lacteal. Lacteals are blind-ended lymphatic vessels that are in the villus of the small intestine. So now we have this chylomicron that's inside of this lacteal, and it enters into the lymphatic system. So once that chylomicron gets into the lymphatic system is directly connected to circulation, to the bloodstream. So this triglyceride then enters into the blood via the lymphatic system. Then it's going to go where? Where do we store fat? Well, we store fat in adipose tissue. And when necessary, we can break it down to use it as a source of energy as well. These triglycerides can also be stored in other cells as well. So we talked about bile salts, and we talked about how the liver produces these bile salts and they get stored in the gallbladder. And then when needed, they pass through the common bile duct, through the ampulla of Vater, and through an open sphincter of Oddi. So when they leave the common bile duct and they pass through the open sphincter of Oddi, they enter into the duodenum. So the bile salts do their job. Okay, they emulsify the fat. And the thing about these bile salts is we can recycle them. When the bile salts reach the ileum,